Well, good morning and welcome to our third session of the morning. Just as a reminder, at 11:45 will be the drawing, so if you haven't filled out your little cards, make sure to get those in. And also, in between sessions, please visit the vendors. They are the folks that really pay for this event, so we want to keep this thing going. So make sure to give them thanks for coming and sponsoring a table here. So it's just a pleasure to have all of you be able to host you guys. So this morning for our third session, we have Adam English. He is the Clinical Director of Orthopedics and Spine at the Cuyuna Regional Medical Center. He has worked in various roles in healthcare for the last 25 years. Adam has presented on various orthopedic and healthcare executive topics, both at the state level and national level. His passion is for the process improvement and improving efficiency for, what was that? Patients. Okay. He writes like a doctor. And he navigates through the healthcare system. So let's welcome Adam English.
Thank you. Yeah, thank you. So thank you for everybody attending here. So I just wanted to, first off, just talk about how complex the healthcare system was. I wanted to give I know I have 15 minutes and I can talk for hours, so let's not get on like these different like pathways about politics and all these other things. So we got to all stay on task here, right? So the first thing is just a couple like quick quiz. How many people think the healthcare system is simple and easy to navigate? It's bright light, but I don't see many hands, so that's a good thing, okay? And then after this pandemic, clinics, hospitals, we made it much easier for you all to come in and see us, right? No, doesn't sound right. And then fellowships, that's the last thing. How many people here know what a surgical fellowship is? So a couple people do, that's good. So that means maybe word is getting out, but not a lot of people know what that is. So I'm gonna try to just kind of simplify things here. I really kind of had a passion for this because recently I helped my father-in-law sign up for Medicare. And thank goodness I have a little bit of a medical brain, but holy cow, that was the most complex thing. I tried to navigate these alphabets of A, B, C, back to a B, C, B covers D, or D covers B, in a setting of B versus A. How do you do it? I don't know how you do it, and it's just so complex. So I always want to couple unique things. So if anybody watches Jeopardy and you're ever on Jeopardy and you have to know the answers to a couple trivia questions, we like to spell orthopedics with an A. And a lot of people have always asked, why is there an A in your orthopedics? Well, it's the original Old English spelling. My last name is English. I do have more Irish in myself than English, but the original English spelling is with an A. So that's, if anyone ever asks you, that's why. And then somebody's, how did that word come to be? Orthopedics, what does that actually mean? Well, the original logo for orthopedics is a stake tied to a bone, and it's a crooked bone. So orthopedics, it means straight, and Pedialyte, pediatrician, kid. So the original specialty for orthopedics was to help straighten out the deformities secondary to the polio pandemic way back. So orthopedics means to straighten, and specifically it started with kids. So there's your 2 trivia questions. Now you can walk out and say, hey, I learned something today. Everybody should walk out of a presentation learning one thing. If you learn one thing, you just learn 2. Just remember the A versus the E in orthopedics. A fellowship. So a fellowship is like an A1 mechanic. So if I have I don't, but let's say you have a BMW. BMWs go to a BMW dealership to get fixed because the service tech at BMW knows how to fix a BMW. They're the A1 mechanic for that BMW. That's similar to what orthopedic surgeons can become. We are unique in the fact that we have all A1 mechanics. And if you see, how to become an orthopedic surgeon. It's a lot of schooling, number one, but the highlight of that is that there's an orthopedic fellowship after they're an orthopedic surgeon. So everybody's an orthopedic surgeon after you complete your orthopedic residency. That means you can do orthopedic surgery. Fingers, hands, wrists, knees, and toes. Some surgeons then go on and become subspecialists. Dr. Severson, he does hips and knees. Clausen, shoulders, elbows. Dr. Moen, hand, wrist, fingers. Kyle Moore, foot, spine, Dr. Stockman. So we have these subspecialists, we call them the A1 mechanics. So when your hip hurts, you're seeing the Dr. Severson team. You're going to see the specialists that went and had that subspecialty training. And that is unique. The other thing is we now started a fellowship. We actually have one of the only fellowships that is a combined upper and lower extremity fellowship in the state and the country. Dr. Clausen tag team up with Dr. Severson to create this fellowship. We're on our second fellow. We'll have our third one start in August. So kind of some cool stuff. If you didn't know what that was, that is exactly what it is. Let's simplify this now. Vehicles and skeletons. They're so alike. This isn't hard. Our vehicle, the tires, they have so many miles. I think now they come with, well, they used to come with a 90,000 mile warranty on a tire, but they got smart. Now I think they put it like I don't know what the warranty is on a tire now, but they'll last long if they're in perfect balance and perfect alignment. That's great until a snowstorm comes and you spin out and hit the curb. Now you throw the tire off. So the balance and alignment of that tire's off, and all of a sudden we start wearing that tire down faster on the one side because the alignment's gone. Think of your skeleton as the same way. Nature puts our skeletal system in good alignment, but then we play softball, pickleball, right? Pickleball's kind of fun. And we might injure ourselves. That injury can lead us to maybe walk a little different, or it throws off the balance or the alignment of our joint, and all of a sudden that joint starts wearing out a little bit faster than the others. And that's what leads to some of these conditions, ultimately needs medical attention, but not necessarily surgery, okay? Cars, we have diagnostic computers. We can plug a little thing into the car. It says, it's your blah, 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 blah sensor. We don't have that in the body yet. I was at a conference in Las Vegas, and they were talking about the future of healthcare, and it was kind of a little scary. They're talking about potentially having these monitors that we can put on ourselves and our blood circulating through our body, having somebody with like artificial intelligence monitoring our bloodstream from remote and saying, hey, little message on your phone, sit down, you're having a heart attack before you even have symptoms. It's a little scary. I don't know if people think that's maybe invasion of privacy and who knows about all that stuff, but it's being talked about out there about how we can remotely monitor ourselves with artificial intelligence. It's not there yet, but it is being talked about. So more to come in the future with that. Exactly. I knew I'd get a chuckle out of here. If I put that picture up in a middle school, nobody would know. I threw that up for my kids, and they were like, I don't even know if they make this game anymore. It was one of my favorite games growing up. So I always said, let's simplify this. Why can't we just simplify this? Like, we meet with all these fancy web designers about, hey, let's make this fancy picture and make all these fancy photographs of people doing things. And I said, well, let's just make it simple for people to get in and get seen. Why can't they just point at what hurts and have a picture pop up with a link to schedule? Makes sense. I mean, or, it should just be simple. Right now, we expect you all to diagnose yourself before you call to get in. So I highlighted a couple words there. Diagnose yourself. Okay, so you're like, oh, go Google. It's my hip. Call the clinic. Get transferred to 15 different people. Hip. 6 weeks out. Then you go in and see person for hip. It ends up being your back. Schedule 6 weeks out to see back. And you're like, oh, this is just a spiraling problem, and where do I go? This is just too complex. Then you go to Arizona for the winter, right? And it's like, I'll just take care of it when I get home. So isn't that kind of like telling the mechanic how to fix your car? It's like me going in and saying, yeah, I hit a curb. I think it's the gasket. And fix the gasket, I guess, because that's what it is. Like, it's just counterintuitive to think like this, where can't we have a spot where you just go in and you say, I hurt. You figure it out. Like, let the professionals figure it out. If it's your hip and you come in and it ends up being your back, well then go see, like, let's make this a little bit simpler here. Let the A1 mechanics figure it out for you. I put this on here. I wasn't going to talk about anatomy and physiology because I didn't want you to fall asleep. But this is just kind of some of the examples about what we see in the clinic. Like, shoulder pain could be coming off your neck. Neck pain could be from a shoulder. I've talked a lot today about the femur, the bone on your thigh. The top of the bone is your hip. The bottom's your knee. I've seen knees hurt up to hips and hips hurt down to knees. So, okay, you schedule an appointment for your knee. It could end up being your hip. We've seen patients with hip pain and it's your back. So how do we differentiate all these different things and make it simple, right? Back to simple. Let's not make this hard. So what we really want to do is, and what we're doing is, and I can kind of put this in my wrap up. So first off, I feel like I'm like the representative of all of healthcare right here, so just let me walk out before you attack me. But somebody needs to apologize to people for what we've done to you. Like, how do we expect people to navigate a healthcare system that's completely backwards? Like, figure out yourself, your diagnosis, and then go see a person, and you're completely wrong, and then go backwards through this navigate. It's just too complex. So apologies for what we've done to the healthcare system. When seeking out healthcare, ask questions. If somebody doesn't want to answer your questions, go somewhere else. That includes our hospital too. If you can't get questions answered, no. We should have full transparency in any question you ask. That is, we owe it to you in healthcare to provide that. So ask questions, seek out. If you put your body, you put your trust in us with your health, you owe it to yourself to ask questions and be the most educated person going into whatever you're having done. And then let us simplify this. So we were talking here a second before I came up here. In 2013, we started this whole ortho program. Dr. Severson revamped it. We brought on 5-6 surgeons. We now have one building where a patient coming in for hip pain, if it's their back, they walk across the hall, go see a back team. If it's their back, or if they come in for back and it ends up being their hip, it's pretty simple. You just get up and you walk over to this hallway. If it's your neck, but it's actually your shoulder, you get up and you walk over to this hallway. It's like, wait a second here, doesn't that make sense? Some people take off of work to like come into that appointment. Maybe just do it all there on that day, if you can. I mean, make it simple. Help them figure it out. And then maybe that'll help them make a more informed decision. And it doesn't matter, if you go seek out care anywhere else, just make sure you are informed on what exactly you're looking for. With that, I think, were we going to do a little question and answer, or are we just going to call it 15 minutes? Or I can stick around if you want. I'll be out at the booth, the CRMC booth. I think if you don't want to do a little question and answer, I can stay up here too if you want, or we can call it. So thank you for your attention and sticking around. Go ahead. I'll do questions, yeah. If we got time, are you okay with questions? Okay. Go ahead. Oh, you don't have one? You just want to do questions? Okay, go ahead.
I do have a comment. Us local will appreciate that in 2024, the Breezy Point Clinic's going to have an open.
Yeah, and that's something we've been looking at. How do we build fast